As a young adult, the prospect of having COVID 19 is an anxiety inducing one. Not only because you're concerned about your own health, but also because you're afraid of infecting those who you live with. I remember when I had COVID 19, there was confusion and anxiety. Would my health deteriorate? Would I infect my elderly mother? The unreliable diagnosis and lack of treatment options only added to my anxiety. Hi, I'm Samrgani, and I had COVID in the second wave that struck India. Having a headache and feeling feverish, I quickly got myself an RT-PCR test, which came out to be positive. Living in a flat in Bangalore with two big dogs, who we knew that if any of us got COVID, quarantining would be the biggest struggle. The moment I tested positive, I shifted into the room, locking the doors so that the dogs don't come in. We had heard from a friend who had allowed their dogs to move in and out from their quarantine rooms that the infection in their home had spread for that very reason. Both my mother and sister have asthma, and we were very afraid of how COVID 19 would impact them. Additionally, my share of the housework now fell on my mother and sister, who were already stressed because of the financial stress of the pandemic, schoolwork, and other housework. Without any help and with me sick, my family became even more vulnerable. The experience raised many questions for me. Why did we not invest in more accurate diagnosis for a disease that was killing millions? Why did we still not have a cure for such a virus? As COVID 19 cases drop, I wonder if we aren't dropping our guard too soon. As a survivor, I wonder if we've invested enough in strengthening our health systems, especially diagnosis and treatment. What kind of preparedness do we have if we get another variant or another such virus? My question is simple. When do we start investing in the health system? When do we invest in improving COVID 19 diagnosis and treatment, even if it turns endemic? What is our preparation for those dealing with long COVID 19? As we congratulate ourselves, let's not be hasty and forget the lives lost. We need to commit to political will and resources to strengthen diagnosis and treatment. We need to strengthen public awareness, and most importantly, we need to ensure that the health system is well prepared. The real stress of COVID 19 for me came from knowing that there wasn't a definitive cure. It was utter helplessness. I felt scared to open my door to even take in my meals. The mere thought of having infected one of my family members after witnessing the devastation that COVID 19 has wrought upon India and the world. Even when you don't know, you don't really have control over such a thing. There remains a sense of guilt and fear of the worst case scenario. I urge decision makers not to ignore stories of COVID survivors. COVID 19 and also health in India overall still needs your commitment and, most importantly, resources.